We're joined via Zoom by epidemiologist Dr. Joe Barnes. A warm welcome to you and thanks very much for joining us here on SABC News, Dr. Barnes.
Good afternoon and good afternoon to our viewers.
The new COVID-19 infections have now surged by 137% since last week. I wonder, there have been fears about a fifth wave, and I suppose, it's safe now to assume that we either headed there or there already. What do you say, Dr. Barnes?
Yes, I'm pretty sure that we are heading there, and it has possibly arrived already in areas in Gauteng, which is the part of our country that's carries the highest population. A quarter of our population live there. In other places it hadn't yet arrived, but I'm a little bit concerned about this sort of almost like an obsession amongst many people about, are we in a wave or aren't we in a wave? We have to be aware every day, wave or not, that the coronavirus is around and is with us and poses a threat. It doesn't only pose a threat during a wave.
Yeah, and I'm also concerned, as you raise some of your concerns there, at the fact that it seems as though people are not even really concerned about, whether we are, what wave we're in anymore. I remember in the beginning it was like, oh my goodness, we're going to wave 2, we're going to wave 3. But as time goes, it's like, oh, okay, it's just, wave 5 we're going into. Does it seem to you as though people are sort of despondent now and not particularly worried?
I would almost call it a pandemic burnout, if you can put it like that.
Yeah.
And it is also helped along by a couple of things. One of them is that the subvariants of Omicron that we are facing at the moment seem to be not nearly clinically causing severe disease, as severe a disease course as we did during the third wave. So people are starting to become maybe a little bit careless, if I can put it like that, or not so worried about it.
Yeah.
And you will notice that there's a surge in cases, but look at the death rate is still extremely low. So, 2 people in the last 24 hours, contrast that to what happened during the third wave with Delta. It was a slaughter, a horrific story. So people are perhaps becoming inured to it, but then on the other hand, I also feel very strongly that the authorities have dropped the ball a little bit on this, because really the best way that we can beat this the fastest is to encourage people to get vaccinated and keep the vaccinations up to date and take the boosters as they become available. And, a couple of weeks ago, I was looking for a place to get my designated booster. I got notice that I'm eligible for it. And I looked for 3/4 of the morning to find a place around me that is open, and this is urban area, city area. Find a place that's open, a vaccination station that I can get my booster. So reality on the ground doesn't quite meet the message.
And while you're talking about vaccines, and in fact that's where I was going. We definitely can't talk about COVID-19 without having a conversation, of course, about vaccines. If we look at the numbers of people who haven't been vaccinated, that number is still relatively high. Would you say that you mentioned authorities dropping the ball? Would you say that authorities have essentially failed when it comes to inoculating and getting people vaccinated? Because it doesn't. I wonder if we'd find a case from this point where people would indeed be fearful enough of the virus to go in huge numbers. I think those huge numbers that we saw are gone and are already gone. I wonder if we'd be able to get those sort of numbers going to get vaccinated now. If I look at some of the places where people do get vaccinated, they are very empty now. So one wonders if indeed can we ever get to that point where enough people are vaccinated?
There are a number of issues there that I feel are crucially important for the country. And one of them is that the government is no longer trying to avoid or prevent infection. They're trying to avoid serious infection, protection against severe disease and against death. This has not been properly convey to people, and the Department of Health is also at the moment urging people to use common sense while they are working on the new regulations that they want to put in place. Now, you can only use common sense if you understand how these things work, so that you can make a choice under the circumstances when you're faced with a change around you. But most of the so-called information campaigns contained only instructions. Go and get vaccinated, wear a mask, wash your hands. There's no explanation so that you can understand the processes and the reasons behind it, even in simple terms.
Yeah.
So how do you make a decision call if you don't understand? So that is also, I feel, a great failing. So people don't understand what they can buy, what protection they can buy by taking the vaccine, so they just shrug it off.
Yeah, Doctor, and I also think it's a little bit difficult to now convince those who haven't been vaccinated to go ahead when, you know, some of the precautionary measures that we had before have been dropped. For example, you know, we've been told that we don't have to wear masks outdoors anymore, things like that. When some of these measures are being relaxed, one I would assume those who haven't been vaccinated think, well, then why am I getting vaccinated?
You know, that's where dropping the ball on giving information was really such a crucial mistake, because it was found after some really good studies that out of doors the risk is very low.
Yeah.
And you can still catch it if somebody is, you know, standing shoulder to shoulder with you, but the risk is much lower. But that was so poorly explained. And now these things sound contradictory to people. But there's another point that has been lost. And it seems as if most people of the vaccine hesitant opinion will be swayed if somebody they trust, whether it's a gogo or the religious leader or something like somebody like that, will talk to them and listen to their fears and convince them, then they will go with that kind of emotional support. But that link between the hesitant and the people that they will trust, the government never asked any one of those people to stand in and say, would you speak for us?
Yeah.
That is completely lost.
All right, Dr. Barnes, it's always a pleasure to see you. Thank you very much for always giving us your time here on SABC News, and I hope that we'll have more of these conversations in future. Thank you so much.
Stay safe.
You too. All right, that is Dr. Joe Barnes, an epidemiologist, joining us there via Zoom.